The other thing that I get asked a lot about, ADHD. Everybody heard of ADHD? Attention Deficit Hyperactivity Disorder. I test actually a lot of folks, a lot of kids and adults for ADHD. So that's looking at problems such as attention, focus, concentration, leaving tasks uncompleted, having a hard time focusing on multitasking or doing work demands, whatever it might be. This can actually start in childhood. I'll typically start seeing kids when they're probably about 6 to 8 years old, and I'll go up and I'll see folks all the way through the geriatric years. So a lot of my adults that I see those are the folks that'll come in and they'll say, I struggled in school a little bit, managed to get C's, had a hard time turning in my paperwork, but I kind of got through things. But now I'm still really struggling as we get older. More demands are placed on us through work, family, whatever it might be. And so they have a harder time kind of keeping it together because the plate's running over full of stuff. So we look at how they're doing and what types of things might be contributing to that, if it is an ADHD issue or if it could be something else. Why I say something else is because I will also have a lot of folks come in and they'll complain of ADHD-like symptoms, and whenever I look at them and do an evaluation, I will actually find out that it's not ADHD. It could be an issue with depression, or it could be an issue with anxiety, or it could be what we call comorbid, so it could be anxiety, depression, and or ADHD. So it kind of gets complicated as you all see. So the other part of my job, in addition to therapy, is to doing different types of assessments. So looking at how your brain is functioning, looking at the symptoms that are present, whether it be depression, anxiety, ADHD issues, or whatever else it could be, and tease those factors apart, because the worst thing that I've seen happen, somebody come in and they'll say, I was diagnosed with ADHD whenever I was a kid. I've been on this medication this whole time. I've not had symptom relief. And I'm like, why are you still taking the medication? Why are you still doing that? So lo and behold, when we take a deeper look to kind of see what's going on the inside, we find out that they've been misdiagnosed for, say, 10, 15 years. So we get them on the right medication, the right type of treatment, the right type of therapy, or whatever it might be, and they start improving in their functioning. So it's very important to actually clarify that diagnosis, and the same thing with kids too, because I'll have a lot of kids that'll come in for an ADHD evaluation, and then the parents will say, my kid's been bouncing off the walls, bouncing off the couch, getting into trouble at school or whatever it might be, and turns out that the kid has a sensory processing disorder issue. So has anybody ever heard of sensory processing disorder? Some of you may have, some of you may not. Okay. So it's one of those things too that will mimic ADHD or mimic depression and anxiety. So all of this stuff plays out on the playground together, and you've got to know what you're doing to be able to tease this apart to get the accurate diagnosis. If you've got the accurate diagnosis, you're going to get a better treatment outcome. The other part of this that's really important to note too is that memory can also be can be impacted by depression and anxiety. I'll have folks that'll come in, they'll report concerns for memory issues. Lo and behold, guess what? You don't have dementia, you don't have Alzheimer's, you actually have ADHD. So again, this is one of these things that it's very, very complicated. So that's why my specialty, and I preach to my patients, let's get a clear diagnosis so we can know what we're doing to provide that treatment.